This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset your
Painful, tender to the touch. May also
same shoulder length, and the other.
But yeah, they're looking into having prior authorization for tests and treatment, even with Medicare now.
And
There's
so why
pilot
do we
programs.
even need doctors anymore? if we're going to use algorithms and data to determine who gets a test and who doesn't, who gets a drug and who doesn't, or who's qualified to be treated, when the doctors are supposed to be the experts who prescribe these things or order these tests, and it gets denied. Nowadays, a lot of doctors check in advance to see what will be,
right?
And they verify if it's going to get covered or not, and then they order a test even though they don't need it. I was talking to someone, they found something suspicious on the mammogram, so they want to do a specialized mammogram, and but then they could just skip to the MRI and see better details, but they won't do that. They have to do this first. So.
Yeah, because the insurance dictates that. I know. It's really and insurance has added so much cost to healthcare and so many extra layers between you and your doctor and all these administrative jobs and even clinics that take insurance. You have to have all these coders and this and that. It's really come away.
I think
and
the
gotten
only
ridiculous.
thing I think the only thing that might benefit people is that I think more people are starting to see how the lack of health care, understanding that we have a sick care system, not a health care system, is the first thing that people have to understand. If you want a health care provider, you have to go look for them. They are outside of the insurance model 90% of the time. You may have a few that dabble, like I'll file on our patient's behalf, but our hands are tied. If I accept your insurance, I can only do what they tell me is necessary for you, and that's not what's necessary for you, but that's what they will that's what they'll pay.
Do you know, anytime we've wanted a provider for our family, we'll call the doctor's office, we'll say, do you take our insurance? If they say yes, we won't go to them. If they say no, we don't take any insurance, we're like, you're our doctor.
Well, I want my doctors to be able to be that. I want them to be able to think outside the box if that's what is necessary.
You guys are outliers for sure. Right. Because
True.
As you're aware, we don't take any insurance
Correct.
At Gameday. And we don't take any insurance because we're not going to waste everybody's time because it's disingenuous.
Yes.
Exactly.
I can count on one. We have hundreds of patients. I can count on one hand the number of guys that have come in and have gotten insurance reimbursement, and they're no longer our patients because they were able to cut a deal with basically they cut a deal with one of their providers to say certain things, and they got coverage.
Right.
One hand of the hundreds of guys that we see. And the most common question I get is, do you take insurance? And the answer is no, because we're not going to waste your time.
Well, and you can't really treat them. That's the challenge,
It's
we cannot treat them properly.
It's to the patient's benefit to not. Now, when it comes to emergency, that's what insurance should be for.
Right. Oh, yeah.
Or
For urgent
catastrophic illness.
For sure.
Catastrophic issues, dealing with late stage diseases and so on, 100%. I mean, those costs are so high. I think insurance should be used for those things. So change in the model. But let me get back to testosterone for a second. I know you guys do more than just testosterone.
Yeah.
I want to hear about that. But right before that, I wanted to mention this because some of our patients, when I recommend, hey, you should probably have your testosterone checked, some of them, when the primary care actually says, okay, and they check it and it's low, then they say, but I'm not going to let you take testosterone because it leads to heart disease. So I went and did this research, and the data says, okay, so if your natural testosterone is here, but you're on testosterone replacement and you bring it up to that same level, you have a higher probability of heart disease than this person. But then I looked up, well, what's the probability of heart disease when your testosterone is low? And it's through the roof.
Yeah.
So I'm like, you're actually lowering your risk of heart disease when you get on. Now, obviously, anything's better if it's naturally high, but if it's naturally low and you need to raise it, then
Yeah.
you're still reducing risk of heart disease.
No, but there was a huge study by the New England Journal of Medicine that came out in the last few years that said, no, it's the opposite. You have a higher risk of heart disease when your testosterone is low, and taking
Correct.
testosterone to optimize your
The
health
amount
is
of
not gonna.
misinformation
Yeah, there's a
in
lot
the hands
of
of
right.
primary
Look
care
what happened.
providers has really shocked me.
Right.
Oh, yeah.
Look what
right,
happened
is-
with women and hormone replacement, right? It was so maligned. For a while, every woman was put on estrogen,
Right.
Premarin, in the 60s and 70s. And then they had the nurses study. But the problem was it wasn't natural, it wasn't bioidentical. And it was they didn't check if women were smoking. And some of the stuff they said, they outright lied about, that there was an increased risk of cancer, an increased risk of heart disease. And it was when women started it. If they were starting it in their 70s, maybe then, well, that's when women have the highest risk of heart disease anyway, right? That many years after menopause. And it totally maligned it. And now so few women are on hormone replacement and just suffering. They have the same exact quality of life issues that men have when their testosterone is low. So
Yeah, for sure. I tell people all the time to get checked. I'm
Oh,
like,
for sure.
should be one of the foundational things.
Can you mention some of those? I mean, low libido.
low libido, brain fog, low motivation, loss of muscle mass, loss of strength, loss of stamina, even erectile dysfunction. And we do deal with all of those separately too. We have peptides besides the weight loss peptides. We have peptides that'll increase your natural testosterone sometimes. We also have, and it's called an extracorporeal shockwave device that can be used for ED. We have platelet-rich plasma injections that we can do for erectile dysfunction too. So we have a bunch of other men's health modalities
That's
too,
wonderful.
besides
And are we
T.
really surprised with all of those symptoms of low T? Are we really surprised someone ends up being depressed? Do you know what I'm saying? Like,
Right.
if you all of a sudden were feeling like you weren't as strong, you didn't have the motivation, you couldn't think clearly, like, of course that's going to be, that's
Right.
a pretty depressing
Yeah,
thing when all of a
yeah.
sudden you don't feel like you can do life like you could 5 years ago,
Right.
even a year ago, 2 years ago. So that's part of the disconnect too, between, I think, people understanding the connection between the physiological and the mental, or the mental effects of your physiology not doing what you need it to do. Right.
Yeah,
And then
most of
there
the
are,
guys we see, they just feel bad and they
Yeah.
want to feel better.
Yeah, for
right?
sure.
And they don't understand why.
Well, there's a
It's
lot
the
of
most common thing we
expectations
hear
on men.
is, I
Right.
just don't want to work out. I've got brain fog. I'm not building muscle anymore. And that makes them feel bad. And
Yeah.
They don't want to feel bad when
but
they're
there's
40 years
physiological
old.
issues with testosterone and hormone
People think-
replacement in the brain, and related to serotonin release and all of those things
Yeah.
too.
I think people often think this is like an older guy's disease, like our patients are in their 50s and 60s and 70s. And
Yeah.
we routinely see guys in the clinic that are in their 20s and 30s with very low testosterone levels.
Yeah.
Why? We're not quite sure. Is it the environment? Is it the food we eat? Is it the pollution? We don't know,
Everything.
but we know
Yes, to
one
all
thing
of
for
it.
Yeah,
sure
it is
guys'
everything.
levels across the board at all ages have dropped over the last 30 years.
Right.
Right.
Something's impacting these guys.
Well, if you look even
metabolic
at our cosmetics, I mean, think about what people are putting on their skin all the time, right? Shampoos, soaps, lotions, which all have estrogen. Like, vast majority of what we're putting on our skin, which is our largest organ, has high levels of estrogen in it.
Mhm.
And we're all doing it, right? Like, unless we're super cautious about what we put on our skin. We think about what we put in our bodies, but we don't always think
And
about what
I
we
think
put on.
mistakenly, a lot of people think if it's on your skin, you're not ingesting it, then it's not as dangerous. But it's in your liver within seconds.
Well, yeah, our feet have the largest number of pores, and they're the largest pores, or the largest number of pores in one area, and they're the largest pores. It only takes about 5 to 10 minutes for it to be in the bloodstream once it's on the bottom of the foot. So, which is great if it's an essential oil or if it's a healthy
And
product.
that's faster than when you eat something.
Yeah, for sure. So, testosterone optimization has become a pretty big buzzword or buzz topic. What do you think some of the misconceptions people have about testosterone therapy or optimizing?
Roid rage, you know, that you're going to be.
Oh, you just want to get jacked up. You just want to build
Right.
muscles. There's a couple guys a month that come in that are gym rats and are looking for that. Most of the rest of the guys just want to feel better.
And actually, usually we
it's
turn
the,
them
it's
away.
the opposite. It's the exact opposite
Yeah.
of that.
Yeah.
Right.
Yeah, I think you're right. I think that's probably one of the most common things that people
you just
think
want to
of.
get jacked. No,
Mhm.
they just want to feel better.
I think they have no idea how hard it is to put on muscle. I mean, especially as you get older, it is not easy.
I was losing my bicep. This is kind of a segue into some of the other stuff that we do.
Yeah.
So we also prescribe some peptides. I'm personally on a peptide called sermorelin or sermorelin, different ways to pronounce it.
It's for growth hormone, right?
Yeah.
It's a short chain amino acid.
Mhm.
It impacts my thyroid. It helps me produce human growth hormone like when I was younger.
Not
And
your
my biceps
thyroid,
back.
your
I
pituitary.
started on it in January. My output on my Peloton, I ride the Peloton because I can't run anymore because I ran too much when I was younger.
Right.
But my output on the Peloton has gone up all year long. My bicep is back from working out. And
That's awesome.
it's pretty awesome stuff.
Yeah.
And there are, hundreds or thousands, I don't know, but there are a lot of peptides out there. We probably prescribe maybe
Just a
six
few
or
that have been
maybe 6 or 8
reviewed
commonly.
a little bit by the FDA. We try not to.
Yeah, BPC 157,
Yeah.
testosterone, sermorelin, things
Just
like
a
that.
few of them.
Just a few
really.
that we know that are, have
Right.
a really nice
Yeah.
efficacy.
That's
Talk about
wonderful.
BPC 157 because that's a popular one these days. And they combine that with is it TB 500 or something?
TB 500, yeah. Now remember, Amir, I'm not the doc, so that's
Right.
really
Yeah.
that's really a Dr. Candace
Well,
question
yeah.
more. But they've really found that guys that are trying to recover from an injury, we prescribe it 2 ways. One, if you've experienced an injury, maybe a hip or an elbow or shoulder or
Right.
something, and you'll inject right near that point of injury, and then more generically, for a better sense of wellness, we'll suggest that you inject it into belly fat, and you would absorb it that way. But really, there's really quite a few guys out there that swear by it
Mhm.
when it comes to recovery from an injury or recovery from surgery.
Wonderful.
Yeah.
Yeah.
Yeah, they call it the Wolverine.
The Wolverine
peptide
pack,
because
yeah.
you
Yeah.
literally
TB
say
500
you
and
regenerate
yeah.
within days.
Yeah.
So
Yeah.
I don't know how accurate that is, but I mean,
Well, I
this is
mean,
what people are saying. This is
Almost everything in the body does regenerate, so maybe it just speeds that process
you know when
up.
when the clients say that, that's very different than when the manufacturer claims, oh,
Right.
That's
this
true.
will help
Right.
you heal in overnight. When patients are saying, oh, I literally healed overnight, you have to
Yeah.
believe that.
It's true.
It's funny. Yeah, funny you mentioned the Wolverine. I literally had a reminder pop up this morning. Remember to bill so-and-so for his Wolverine. He wanted to start today, but he had to wait for payday.
Oh,
He had to wait for the
got
15th
it.
because he wanted to start it on payday. So, yeah, he was ready to go with Wolverine. Yeah.
That's awesome.
Yeah, would you say these peptides kind of came on the scene within the past few years? I mean,
Or became popular,
Yeah.
we'll say, within the past
mean,
few
we've
years.
always
Tony
had
Robbins wrote a
peptide.
book, Life Force. I think it's called Life Force. Is that what it's called?
Yeah.
And he's got multiple chapters on peptides, and he lists them
Right.
all, and he also talks about stem cells quite a bit, and how
Right.
there's a spray gun that you spray stem cells on burn victims, and literally their burns heal within days with no scarring. They're talking 3rd-degree burns are healing within record speed. And anyways, those things are not available in the
familiar
United
with that at all.
States. But
yeah, not familiar with that at all.
Yeah.
I didn't know the word peptide about 2.5 years ago.
Yeah.
You know,
Well, several amino acids together is a peptide, and
Sure.
we know that the body
but I'm a
produces
physicist. But remember, I'm a
a lot.
physicist.
That's
Right.
the
That
organic
wasn't in my
chemistry coming
lexicon.
out.
right, produces a lot of different peptides. So we're learning more, and we are very cautious about it, and definitely don't promise people a lot of things, and we try and stick with the peptides that have been studied more than some other ones, because we do have compounding pharmacies telling us about all these other peptides.
Yeah,
they're
the number that we have
concocting. Yeah.
available increases. It seems like every week practically.
Right, but we only really use
Yeah,
the
there's
ones
only a
that
handful
have
of the
been
ones that
around
we
a long
like
time.
are really
Cimarelin
will
is
endorse.
actually a peptide that was used years ago as a diagnostic test for kids with growth hormone deficiency. So that one's been FDA approved for that, and it's been around for years and years.
So if a child has growth hormone deficiency, is that a
they're
pituitary
using
gland issue or?
sometimes, yeah, it can be. So and they'll there can be other reasons for it, but they use that as a diagnostic test to see if they
So
do.
they'll give them Cimarelin, and if their growth hormone doesn't go up, they have deficiency. Is that
Yeah,
how they use it?
I
As
think
diagnosis?
so. I haven't really worked with kids that way, but that's what it
Okay.
was primarily used for at the
That makes
time.
sense.
So
What role do you guys think that diet and sleep plays in maintaining and optimizing testosterone levels?
oh, huge with anything. Diet and sleep really affect it. Women that go through menopause and eventually start hormone replacement with progesterone and estrogen are sometimes given a little bit of testosterone too to help with sleep. So it can. Sometimes if your T is very low and we start you on it, you might have some sleep issues early on until your hormones regulate sort of, and you get used to higher levels. And we also always believe in starting at the lowest level possible and then recheck you and then go up. It's so much easier to just add more as opposed to try and tell you to stop for a
Right.
week and things like that. So we're
Gotcha.
pretty cautious about that too.
I like
Is there an age? So I was 48. That's 3 years ago, and I didn't have any of the symptoms, except for one thing. I just started putting on. I was eating the same diet, and I started putting on body fat. Body fat just kept increasing, so my weight was going up, but it wasn't muscle. But I didn't have motivation, energy, libido. Everything was still exactly the same that I had noticed. No fatigue, felt just fine. And then someone said, well, why don't you get your testosterone checked? Turned out it was 243 at the time. And so then I started on replacement therapy at that time. And then the fat came off within the next, I would say, 6 months.
Right.
The extra body fat came off, and then I felt normal again, or looked like what I wanted to. But would you recommend an age where every male should get, because they say once you're 40, or they used to be 50, and I say 40, you should have your first colonoscopy,
Right.
or get your cholesterol checked every year.
But there's
whatever.
a reason why they had to move that age.
Well,
Because our food
prevalence-
sources,
yeah.
well, yeah, the prevalence was then it went to 40s
Yeah.
and now it's 30s.
Well, and we reported on this on one of the
Ugh.
articles was that we have 30-year-olds getting colon cancer, and that didn't used to be the case.
Right.
I had a daughter that died from it,
I'm so sorry.
Yeah, that's really
Wow.
hard.
colorectal cancer.
Yeah.
We got it when she was 38. She was gone at 41.
Wow.
Yeah.
That is so young.
Yeah, and she
Heartbreaking.
was not alone.
Yeah, it is. It's our diet, being overweight, alcohol, all of those things contribute to it.
I
So-
started doing some research when an article came out about that, just how the prevalence had increased so much in the lower ages. And I started doing research. That's how my brain works. And I was like, well, what happened 30 years ago, right? What increased so dramatically? And one of the things that was brought onto the scene and used so much was high fructose corn syrup. That is directly linked to colorectal cancer. And it's in
For
everything.
2 years, they misdiagnosed her.
Mhm.
Right.
For two
'cause
for 2 years,
people didn't
they
think somebody
misdiagnosed her.
Because she was so young.
And by the time,
Yeah,
because she was so young, and by the time it was properly diagnosed, it was stage 3.
Ugh,
and she was gone about less than 2 years later.
gosh, that's so
And
devastating.
Amir, back to your comment about weight loss. Weight loss is one of those early symptoms that we hear from guys. And as far as age, I can't put an age on it anymore. I mean, I
Yeah,
can't
we
tell you
are.
everybody that walks in is 50 or 40. We literally see guys in their 20s, 30s, 40s,
I was
50s,
shocked
60s,
too
70s.
about that.
All that whole
I believe it.
50-year
Even
span. We're seeing
20s
them
and 30s, right?
every week.
I mean, we don't know. There's a lot of environmental issues. Probably we know that microplastics are hormone disruptors, and so it's really hard to tell. We know the obesity epidemic in America. You know, when you're heavier, you're aromatizing testosterone to create more estrogen in your fat tissue, and so your levels are lower too. So it's the lifestyle. So we are seeing younger and younger guys. I was pretty surprised too when we first opened the clinic that many younger guys. Even from when I did urology back in the 80s, I was shocked we didn't see as many.
I want to make
with
sure everybody
low T.
heard what you just said, because we should emphasize is that body fat percentage going up could be one of those contributing factors, because everybody's body fat percentage is higher now than it was 20 years ago,
Right.
40 years ago, and
Right.
80 years ago.
Right.
And so that could be one of those things. And as body fat percentage goes up, estrogen goes up in men, and more testosterone gets converted to estrogen
Right.
in the body.
Right.
If guys are putting on weight and it is because of low T, if they haven't put on too much weight, we can often see them get on T and them start to lose that weight. They can work out more and they do start to lose the weight. But for guys that walk in and we
That
see
are
them every week
morbidly obese.
that are 50 pounds, 100 pounds, we've had guys walk in the clinic 150 pounds overweight. Just getting on T isn't going to do it. And
Right.
we are big fans of the GLP medicines. We think they're unbelievably effective. They're safe. And a lot of the problems that you hear about these medications is when they follow the big pharma protocol, start on 2.5 milligrams, 4 weeks later up at the 5, 4 weeks after that 7.5. We don't do that. If you
That's
start
good.
out on 2.5 milligrams and you
You're
come and see us a month
consistently
later
losing.
and you're still making progress, you're feeling good, guess what? We don't up the dose.
Nice.
We keep you right where it is.
Right.
It keeps your
Lowest
cost
effective
keeps your
dose.
cost down,
Yeah.
keeps you feeling good, and keeps you positive about
Right.
doing this. We
Yeah.
find a lot of these quote unquote side effects are from jacking
Too
up the dose
high
too
doses,
much.
right.
And you know what that is? That's following Big Pharma's protocol.
Exactly,
I would believe
exactly,
that.
because their motivation is different, and
Right.
it's so sad because I saw an article that said most medical doctors get their medical education from drug reps.
Yeah.
So these drug reps come in dressed nice with a suitcase of samples, and they tell you
And
exactly how to
food.
prescribe something, and food, lots of food, yeah,
Can't do
and
the
gifts
trips
and
anymore.
toys
Everybody's
and
disappointed in that.
offers, and yeah, you know, I also wanted to, before we move on too far, the colorectal cancer. I want to make sure our audience, everyone knows, we're not saying it's their fault.
No.
You know,
No.
there's please understand, this is if you're battling something and you're hurting from it, and you hear us talking about lifestyle and not eating, we didn't know high fructose corn syrup was so dangerous. There's other things we don't know that are dangerous, and then there's medical procedures and protocols that come out and then they get pulled off the market because later on they find out that was causing cancer and that was doing things. So we'd never blame you for what you're going through.
But as that is correct. However, we all individually have a responsibility to do research. And that's part of the issue, is that as a consumer in our culture, you cannot take marketing at face value. You
Right.
cannot listen to big box food companies because they are some of the same people who owned the tobacco companies. People, that it's your health is not their first concern. It's not a concern at all. Profit is the concern. And so if it's not grown naturally, then you should know that the likelihood of it being harmful to your health is very, very high.
Ultra processed food. That's the
100%.
problem. We've gotten into too much ultra processed foods in the United States. And
Yep.
and as you said, some of the reason it's not your fault and you can't take action is that it depends where you live too, right? There are food deserts where families and children don't have access to fresh fruits and
100%.
vegetables. So it's all the policies also related to the foods. And you're right, and all these industries, they have lobbyists that, you know, spend a lot of money and time with the people in Washington making the policies. So it's that whole thing, you know, and people buy ultra processed foods now, and grocery stores have them, is because they do last so long, you know. In one time, you know, in Europe, you would almost go shopping every day, right? To get fresh bread every day and get
That's how it was in
fruits
Iran.
and vegetables.
Yeah.
Right. You had to do that every day. But then, you know, it's our whole society. We don't walk enough. There's no more towns, you know,
want
everybody
everything yesterday.
drives. You
Our
gotta
fruit would spoil within a day and a half to 2
Right.
days. You went to, there were no grocery stores. We had fruit stands.
right.
So it was a row of
Right.
fruit stands that people would just pick those from their garden early that morning. They display it that day. They get purchased that
Right.
day. they
There's
get
a
consumed
chicken
that day.
store, there's a beef store,
That's right.
there's a bread store.
And every morning, my dad and I used to get on our bikes and ride our bikes to the bakery and get fresh bread, bring
Right.
it back, and we'd all have breakfast. I mean,
Right.
that was
I can
the
eat
morning
bread
routine.
there with no symptoms or side effects from
Oh,
it.
really?
Amazing.
Yeah.
Yeah.
Right.
But you
And
can do that in Europe too.
Gluten
Yeah.
the
sensitivity
gluten issue
almost
stuff.
disappears when
Right.
yeah.
So it's the lifestyle that we have today too. I mean, you should try your best, but there are some people that even trying their best isn't really going to help them because of the issues we have with certain populations and, you know, inner cities and socioeconomic groups. That just isn't fair. But that's part of it. But cancers too, not just colon cancer, breast cancer, all of those cancers are related to body fat, estrogen, you know, testosterone, things like that. So, you know, it's just something you do have to be aware of. So.
Absolutely. Well, what excites you guys most about what's up and coming with men's health? There's, I think, been a big push for like functional medicine and, you know, people being willing to step outside of the major medical model to get the help that they need. So is there anything that you guys see on the horizon or anything that's kind of exciting you about what you guys are doing or what you see coming down the pipe?
I think it's just kind of exciting that guys are willing to step away from their primary care provider and realize that they don't have all the answers and they may have to go somewhere else and it may cost them something.
Mm-hmm. Yeah.
Right? I think that's pretty cool. Lots of guys come in and they'll readily tell us, yeah, he told me my numbers were good and there wasn't anything he could do, but that just doesn't sound right.
Mm-hmm.
And so I think that's pretty cool.
That's
The
awesome.
guys are willing to come see us. Right?
Yeah, that they're
Who-
going
who's-
to
who's
any
ga- who's
appointment,
game day?
actually, right?
Right?
Right.
Who's game day? What do they do? And they're willing to give us a shot.
That's
Right.
wonderful.
Yeah.
That's great.
Yeah, I
That is
agree.
exciting. The conversation, just general conversation nationally has changed. You know, they don't call us quacks anymore when we talk about ultra processed food.
Yeah.
That actually used to be my name, Quack. Now it's different. So
Yeah, it is true. But by the same token, you know, as they're talking about chronic disease and ultra processed food, which is true and noble, the idea that putting regular sugar into Coca-Cola or taking out some of the artificial colorers in candy is suddenly going to make us healthier. So that's
Correct.
not the issue. I mean, we really need to get fresh fruits and vegetables to all citizens in the United States.
Yeah.
Right when we're cutting programs for that. So
We do our part.
Right.
Did you get that from the organic aisle? Did you get the organic potatoes?
Well, she'll tell you everything's organic. It just has to have carbon in it.
Right, that's true.
Really, because that's the definition of organic, correct? So everything's organic.
Right.
That's so funny.
Well, this has been fantastic.
Yeah.
I think we could talk to you guys all day and forever.
Yeah, thank
and
you.
I'm sure we'll have some
Thank you so much.
questions that show up on our feed and from the audience. If it does, we'll either send you the questions or maybe we'll just have you back on to answer those questions.
Amir, I got one more thing.
Please.
Just for your audience, we are a veteran-owned establishment.
That's
Oh,
right.
I love that.
And we love our veterans and our first responders, and we price all of our products and services fairly.
That's
but
true.
Veterans and first responders, police officers, firefighters all get at least a 20% discount on all of our testosterone-related services.
Oh, that's
we
fantastic.
really want to give back. You know, I spent 24 years on active duty. You know, we weren't paid the most of everybody on the block.
Right.
So we like to give a
course.
little bit back. So I did
Not
want to
only
mention
that,
that we
I-
appreciate our first responders.
I
That's
would
awesome.
assume the stress that comes with PTSD, which the nightmares and everything that affects them, and being able to sleep and recover and regenerate tissue and all of that, and they need this.
Over half of our patients fall into that category,
Oh,
Wow.
yeah.
first responder or veteran.
Right.
Plus, we
Especially out here in Frederick, and I should be more specific. Out here in Frederick, over half of our patients fall into that category.
Absolutely.
Yeah.
And also, we talked about stress. You have a book on stress, I have a book, and how that can affect your hormones too.
Right.
And that can lower
yeah.
testosterone and affect all kinds of hormone shifts in men and women. So it's important to get a handle on your stress.
Yeah, we talked about sleep, and we know that so many of those guys in those professions, first responders, police,
Right.
their sleep cycles are
Right.
so messed up. We've had so many patients who are police officers, firefighters, and whatnot, and really to be able to keep good health that's another full-time job for them, because they're up against so much with the
Well,
lack
when
of
you
sleep
work
changing.
night times
Mhm.
and shift work, we know,
Yeah.
Right. Yeah, the
nighttime
firefighters
shift
just-
you work.
Those
is-
schedules are brutal.
Yeah.
Yeah, for sure.
You know, not only that, they see things nobody should see.
Mm.
Yep.
They see victims, they see injuries, they see people, they see bodies, and they're around that
Yep.
every day, and so they resort to alcohol
Mhm.
just to be able to sleep. And then now we know alcohol is a huge hormone disruptor.
Right. And it also disrupts your sleep pattern
Yeah.
too. It's not
Exactly.
good
So
for
they may
sleep.
pass out, but they're not getting the REM sleep that
Right.
their body needs.
Right. Or the
Yeah.
deep sleep. Yeah.
So your book is on Amazon and Barnes and Noble
Yep.
and bookstores, and
Mhm.
fantastic. So we'll definitely put a link down below for people to hopefully check it out. It's the parts I read were really good. I can't wait to dive in and read the rest of it. And
Thank you.
yeah, really.
I have an
appreciate it.
event coming up we have a small independent bookstore in Baltimore called the Ivy Bookshop, and that's on the 21st, and I'm going to be
Next Tuesday.
talking to Tom Hall at WYPR. He's going to talk to me about
fantastic.
the book
That's awesome.
Yeah.
on
That'll be good.
We're excited.
WYPR.
All
Yeah.
right. Well, hopefully our
Fantastic.
audience will check that out too, and I'm sure it's going to be an amazing conversation. And I'd love to get into that maybe down the road when we have you back on as a guest to
Right.
really talk about some of that and your concepts on stress and women's health as well. For having said all that, thank you
you for
again.
having
Thanks
us.
everybody
Yeah.
for
Yeah.
joining us,
Thanks so much
and
for being here.
we'll see you next time for the next episode.
See you then.
Thank you.
Thank you.
Thank you.
Yay.
Live radio, local podcasts, the Frederick Podcast Network at listenfrederick.com.